Staged excision is a surgical technique that's most commonly used to treat skin cancers or melanoma on the face or areas where we're trying to conserve skin. As opposed to a standard or wide local excision, the staged excision is different because it is staged, meaning that it typically requires anywhere from 1 to 3 surgical visits to completely have the lesion removed and the area sutured closed. The first step in a staged excision is to identify the biopsy site. A biopsy precedes excision and helps us diagnose what we are removing. After the biopsy site has been identified, we mark out a margin. Margin refers to normal appearing skin around the lesion that we're removing because we want to make sure to get all the roots of the skin cancer or melanoma out. For the earliest forms of melanoma, this usually is about 5 millimeters. If it's a little bit deeper, it can be 1 centimeter. Deepest melanomas tend not to be treated with staged excision, and we tend to use our colleagues in surgical oncology or medical oncology. So staged excisions are typically used for early forms of melanoma. After the biopsy site has been identified and marked, we then numb the area using local anesthetic. The local anesthetic numbs the skin, but you are awake. This is the safest form of surgery. After this, the skin is very thoroughly cleaned and draped with sterile towels. The surgeon then proceeds to use a scalpel and remove the skin that has been marked. At this time, the bleeding areas are stopped and the wound is cleaned and bandaged. This means that the wound is left open while clean and covered while the skin is sent off to the pathology lab. Results typically take several days to come back, and during this time, you will be educated on how to take care of your wound. So surprisingly, having an open wound is actually painless. There is no tugging or suturing, which is typically what pain after surgery comes from. Most of the time, we do have the lesion removed on the first try, although about 10 to 20% of patients do need additional skin removed, meaning that the margins were not clear. This is much easier to do with an open wound because no sutures need to be removed. We then go back to the edges that still have the skin cancer involved and only remove those edges of skin. This is where the tissue conservation comes into play. At this point, the skin is sent again to the lab, so results will take another few days. The patient again takes care of the wound during this time, and most often, after that second attempt, the lesion is completely removed, and then you return to the office for the area to be sutured closed, knowing confidently that all the roots of the skin cancer have been completely removed and that as much of the normal surrounding skin has been maintained. After staged excision, recovery time is anywhere from 1 to 2 weeks after the area has been sutured closed. Since staged excision tends to occur on the face, typical recovery times are about 1 week, where you will need to have the wound covered with daily wound care, and physical activity needs to be limited. If we do a staged excision on the fingers, toes, or legs, then healing in these areas is a little longer. It's about 2 weeks, where the wound will need to be bandaged with daily wound care and physical activity should be limited. The cure rates for staged excision are very high, about 90 to 95%. The other real benefit of staged excision is it balances those cure rates with conserving normal tissue, which on areas like the face or the hands can be very important for cosmetic outcomes, but also for functional outcomes.